Hey everyone, and welcome to a deep dive, specifically for all of you nursing students out there who are working on those fundamentals.
Yes.
We are going to unpack human growth and development today.
Right?
I know you're thinking textbook stuff, right?
Yeah.
But trust me, this is not just about memorizing a bunch of facts for that next exam.
Right.
We're going to explore how understanding these concepts can really make you a better, more insightful nurse.
I think one of the things that's so fascinating about this topic is it goes way beyond the surface.
Okay.
We hear growth and development used all the time, even interchangeably, but they really have distinct meanings.
Okay.
Growth is all about those obvious physical changes.
Yes.
Height, weight, all that good stuff.
Yeah.
Development, on the other hand, is a little bit deeper. It's about that complex interplay of maturation and learning and how that shapes our thoughts and our feelings and even our behaviors.
So growth is like you're measuring on a growth chart.
That's right.
And development is like, well, everything else.
Exactly. And here's the kicker. Okay.
They're intertwined.
Okay.
Think of it like a dance.
Oh.
Where growth provides the stage and development choreographs all those intricate moves.
Okay.
They constantly influence and shape each other throughout our entire lifespan.
So it's not just about getting bigger. It's about how we become who we are.
Exactly.
How we learn to walk, talk, solve problems, even manage emotions.
That's it. And just like any complex process development isn't always a straight line.
Right.
There are bursts of progress, plateaus, and sometimes even regressions.
Yeah.
You think about those growth spurts kids go through.
Yeah.
Some they're shooting up like weeds, and things settle down for a bit.
Yeah.
Development kind of follows a similar pattern.
Yeah.
You have those periods of rapid change followed by those periods of consolidation.
I'm already starting to see how this applies to nursing. Like, we're not just treating diseases, we're caring for people who are constantly evolving and changing.
Absolutely. Now let's talk about the age-old debate.
Uh-oh.
Nature versus nurture.
Freak go. We know our genes, those things passed down from our parents, lay the groundwork.
Right.
They're like the blueprint for our physical traits and predispositions.
Yeah.
But here's where things get really interesting. Our environment and our experiences play a huge role in shaping how those genes express themselves.
So it's like you have this recipe.
Yes.
You've got your ingredients, which are the genes.
Right.
But the way you cook them, the environment determines the final dish, which is who we become.
That's a great analogy.
Thanks.
The Human Genome Project, which mapped out all the genes in human DNA,
Right.
really opened up a whole new world of understanding about this complex interplay.
Yeah.
We're not just passive recipients of our genetic code.
Okay.
Our experiences, choices, even our environment can modify how our genes function.
Hold on, wait. So you're telling me our genes are not set in stone,
That's right.
that our experiences can actually change how they work?
That's right. And this is where that fascinating field of epigenetics comes in.
Epigenetics, okay.
It explores how factors like stress, nutrition, even trauma can leave a lasting mark on our genes, influencing everything from our physical health to our mental well-being. It's like highlighting or underlining certain parts of that genetic blueprint, making some instructions louder and others quieter.
Okay. This is blowing my mind a little bit.
It's pretty amazing stuff.
Like we're not just products of our genes. We are dynamic beings shaped by our experiences in the world around us.
And understanding this concept has huge implications for healthcare.
Okay.
It means we can empower our patients to make choices
Right.
that positively influence their health outcomes. And it also helps us understand why some people are more susceptible to certain diseases or why they respond differently to treatments.
This is already so much more nuanced than I imagined.
A lot to unpack.
It is. So we've got growth, development, nature, nurture, and now epigenetics.
We do.
But how do we make sense of how all of these factors shape a person's journey through life?
Yeah.
Is there a roadmap?
That's where developmental theories come in. Think of them as different lenses we can use to view and understand human behavior throughout the lifespan.
Okay.
They provide frameworks for understanding the challenges people face and the milestones they achieve at different ages.
All right. I'm ready for some aha moments. Let's dive into these theories.
Let's start with one of the... Now, some of his ideas have been debated over the years.
Right.
But his emphasis on early childhood experiences shaping personality remains significant.
Okay.
He proposed the psychosexual stages,
Yes.
where different areas of the body become the focus of pleasure as a child grows.
Right.
For example, the oral stage, which occurs during infancy,
Yeah.
is all about exploring the world through the mouth.
Okay.
Cracking, biting, tasting, everything in sight.
It's funny how those seemingly simple behaviors can tell us so much about a child's development.
Exactly, and understanding these stages can help nurses anticipate potential issues.
Okay, how?
Imagine a young mother struggling with her 12-month-old who's constantly putting things in their mouth.
Yeah,
Knowing this is typical behavior for that oral stage can help the nurse reassure that mother,
right.
educate her about creating a safe environment, and offer practical tips for managing this exploratory phase.
So it's not just about labeling a behavior, it's about using that knowledge to provide better care.
Exactly.
Okay, what other theories can help us navigate this complex landscape of human development?
Next up, we have Erik Erikson.
Okay.
He built upon Freud's work,
Okay.
but focused more on the social aspects of development.
Right.
His psychosocial stages highlight those core conflicts that individuals grapple with throughout their entire lives.
Conflicts. Can you give me an example?
Think about the first stage, trust versus mistrust.
Okay.
Infants are completely dependent on their caregivers.
Right.
If their needs for food, comfort, warmth are consistently met,
Yeah.
they develop a sense of trust in the world and in their relationships.
I see.
But if those needs are neglected or inconsistently met, they may develop a sense of mistrust, which can affect their future interactions and relationships.
Yeah, that makes perfect sense. It's like building that foundation of trust from the very beginning.
Exactly.
But what happens after that initial stage?
Well, as toddlers gain more mobility and language skills,
Right.
they move into the autonomy versus shame and doubt stage.
Okay.
They want to do things for themselves.
Yeah.
Walk, talk, explore.
Of course.
Encouraging this independence helps them develop self-confidence.
Right.
However, if they're constantly criticized or restricted, they might start doubting their abilities and become hesitant to try new things.
So it's a delicate balance between providing support and allowing them the freedom to explore and learn.
Exactly.
I'm already seeing how this could be applied in pediatric nursing.
Absolutely. And these stages continue through adulthood.
Oh, wow.
We have initiative versus guilt in preschool,
Okay.
industry versus inferiority in school-age children, and so on. Each stage presents unique challenges and opportunities for growth.
This is really making me think about how we approach patient care differently, depending on their age and developmental stage.
Precisely. For example, a hospitalized 8-year-old child might become agitated and withdrawn,
Okay.
understanding that they could be struggling with industry versus inferiority.
Mm-hmm.
A need to feel competent and accomplished
Right.
can guide the nurse to incorporate activities that allow them to experience success and build their confidence, even within the hospital setting.
So it's like even when they're sick, their developmental needs don't disappear.
Exactly.
We have to consider the whole person, not just their illness.
That's right.
Okay, so Freud and Erikson have given us a lot to think about. Are there any other key players on this developmental theory team?
There are a few more I think you'll find helpful. How about Jean Piaget,
Okay.
who focused on cognitive development?
Ooh, Piaget. I remember learning a bit about him in school.
Yes.
Didn't he say something about kids, like, literally thinking differently than adults?
Yes. He proposed 4 stages of cognitive development.
Okay.
For example, in the sensorimotor stage, babies learn through their senses and motor actions,
Okay.
touching, tasting, moving objects.
Right.
They gradually develop object permanence,
Yeah.
which is the understanding that things continue to exist even when they can't see them.
That explains why peekaboo is so entertaining for them.
Exactly.
They're genuinely surprised when you reappear.
It's a big deal.
It is. But how does knowing this help nurses?
It highlights the importance of tailoring our communication and care based on a patient's cognitive abilities.
Okay.
A toddler, for instance, can't understand complex medical explanations,
Right.
but a school-aged child might benefit from simple diagrams or models to help them understand their condition.
So it's not just about simplifying things. It's about meeting them where they are mentally
Exactly.
and using age-appropriate language and teaching methods.
That's it. And then we have Lawrence Kohlberg,
Okay.
who focused on moral development, which is how our understanding of right and wrong evolves as we mature.
So we're talking about more than just not stealing cookies from the cookie jar.
Definitely, Kohlberg believed that moral reasoning progresses through these different levels.
Okay.
It starts with a focus on avoiding punishment
Right.
and moves towards more complex considerations of social rules, ethical principles, and universal human rights.
Wow.
He also acknowledged the influence of culture and social norms in shaping our moral compass.
Thinking back to that 8-year-old patient we talked about, his cultural background might influence his perception of the hospital and his care.
Absolutely.
It's a reminder for nurses to be sensitive to these individual and cultural differences.
Absolutely. And finally, we have Carol Gilligan,
Right.
who challenged some of Kohlberg's ideas and proposed that women develop a morality of care,
Okay.
where relationships and responsibility for others take center stage.
So it's not that one theory is right and the other is wrong. It's about recognizing that different perspectives can enrich our understanding of human development.
Exactly.
This is all so much more nuanced than I initially thought.
And that's exactly why these theories are so valuable for nurses.
Yeah.
They provide frameworks for understanding our patients,
Right.
their behaviors, their needs, their fears, and ultimately for providing compassionate and effective care across the lifespan.
This deep dive is already eye-opening.
Good.
I can't wait to see where we take this next. But for now, I think our listeners might need a moment to process all these incredible insights.
Indeed, the intricacies of human development are truly a fascinating journey of discovery.
I agree.
You know what's truly remarkable about these theories we've been discussing?
I'm hooked already. What is it?
Well, it's that, they were developed decades ago.
Right.
Yet they still hold so much relevance today.
Yeah.
They really highlight the fundamental needs and challenges people face throughout their lives, regardless of the era.
That's what I love about this deep dive. We're not just talking about abstract concepts.
Yeah.
Here we are connecting them to real-life nursing scenarios.
Right.
It makes everything click into place.
Precisely. And speaking of connecting the dots, there's another important figure I think we should add to our developmental theory dream team,
Okay.
Robert Haverhurst.
All right. Bring on Haverhurst.
Yeah.
What did he bring to the table?
Haverhurst focused on something he called developmental tasks.
Developmental tasks. Okay.
These are essentially the skills and competencies that we need to acquire at different stages of life.
Okay.
He believed that successfully mastering these tasks leads to happiness and smooth transitions,
Makes sense.
while struggling with them can create difficulties later on.
So it's like a checklist of things we need to learn and accomplish as we grow.
That's a great way to put it.
Okay.
For infants and toddlers, those tasks revolve around basic survival and development,
Right.
learning to walk, talk, eat solid foods.
Yeah.
As children move into middle childhood,
Okay.
the tasks shift towards social skills, academic learning, and developing a sense of competence.
It reminds me of climbing a ladder. Like you need to master each rung before you can move up to the next one.
Exactly. And as we enter adolescence,
Oh, boy.
the tasks become even more complex.
Yeah.
We're talking about navigating those physical and emotional changes of puberty,
Right.
developing a sense of identity, figuring out who we are in relation to our peers and the world around us,
Right.
even starting to think about future careers and adult roles.
I remember those teenage years. Talk about a roller coaster.
It is.
Trying to fit in, dealing with all those hormonal surges.
Yeah.
Figuring out what you believe in, what you want to do with your life.
It's a time of intense growth and transformation.
It is.
And as we transition into adulthood,
Okay.
the tasks shift yet again. Now it's about building intimate relationships,
Right.
establishing ourselves in careers, perhaps starting families,
Right.
and finding our place in the broader community.
This is making me think about some of the patients we talked about.
Yeah.
Imagine a young mother feeling overwhelmed and isolated. Could this be related to the challenges of juggling those early adulthood tasks?
It's definitely possible balancing the demands of parenting with work relationships and personal growth
Yeah.
can be incredibly challenging, especially without a strong support system.
Right.
Understanding this can guide nurses to connect patients with resources and offer support tailored to their unique needs.
It's like these theories give us a roadmap not only for typical development,
Right.
but also for understanding where things might go off track.
Exactly.
They help us see the bigger picture and provide more holistic care.
Precisely. And that's crucial for nurses because we encounter people at all stages of life, each with their own story and their own set of challenges.
Right.
These theories give us a framework for asking the right questions,
Yeah.
anticipating potential needs, and providing truly individualized care.
Okay, so we've covered Freud, Erikson, Piaget, Kohlberg, Gilligan, and now Haverhurst.
We have.
That's quite a lineup of developmental superstars.
It is.
Are we missing anyone from our all-star team?
Well, we can't wrap up our discussion without mentioning a couple more theorists who offer valuable insights into adult development.
Okay.
How about Roger Gould?
Okay, I'm intrigued. What did Gould bring to the table?
Gould focused on the transformations adults undergo throughout their lives.
Hmm.
He challenged the idea that adulthood is static and unchanging.
Oh, interesting.
Instead, he saw it as a series of phases,
Okay.
each marked by the dismantling of false assumptions and the gradual development of self-acceptance.
So it's not like we hit adulthood and suddenly we have everything figured out.
Not at all. Gould identified these specific phases within adulthood,
Okay.
each with its own set of challenges and opportunities for growth.
Oh.
For example, in the leaving the parents' world phase,
Okay.
young adults grapple with separating from their families both physically and emotionally,
Right.
and establishing their own values and goals.
Oh, that resonates with me. It's that gradual process of realizing that your parents aren't always right.
Right.
Sorry, Mom and Dad. And that you have to forge your own path in the world.
And it can be a bit unsettling,
It can.
but it's also incredibly liberating.
Yeah.
Then you have the getting into the adult world phase,
Okay.
where individuals focus on building careers, forming relationships, and often feeling pressure to prove their competence and establish their independence.
I remember those days, well, juggling work relationships, finances,
It's a lot.
all the other joys of adulting, while still feeling like I was figuring things out as I went along.
It's a common experience.
It is.
And Gould's theory reminds us that these challenges are a normal part of adult development.
Right.
Growth and change don't stop when we hit a certain age.
So even those seasoned adults are still on a developmental journey.
Absolutely. And Daniel Levinson,
Okay.
another researcher on adult development,
Okay.
emphasized the importance of life structures.
Precise structures.
These are the patterns of relationships and roles that shape our lives.
Okay.
He proposed that major life transitions, like starting a family or changing careers, require us to restructure these life structures to accommodate new roles and responsibilities.
So it's like each new phase of life requires us to adapt and redefine ourselves.
Precisely, Levinson's work underscores that dynamic nature of human development.
Yeah.
It's not a linear process, but rather a series of transitions and adjustments as we navigate the ever-changing landscape of life.
I'm seeing a common thread here. All these theories, while different in their focus,
Yeah.
emphasize that development is an ongoing, lifelong process.
Exactly. And that's a powerful message for nurses.
It is.
We need to meet our patients where they are developmentally recognizing that growth and change don't stop at a certain age.
It's like we're all works in progress, constantly evolving and adapting to life's challenges. And as nurses,
Right.
we have the privilege of being a part of that journey.
Indeed, the beauty of human development lies in its continuous unfolding.
Okay, so we've explored a ton of theories,
We have.
and I'm starting to grasp the impact of this knowledge on nursing practice.
Good.
But can we get even more specific? How does all of this translate to the bedside, to the actual care we provide?
That's a fantastic question, and that's where we'll shift our focus next.
Yep.
Let's delve into the practical applications of developmental theory in nursing care.
Okay, so we've covered a ton of theories, and I'm really starting to see how this knowledge can shape how we approach patient care.
Yeah, it's about connecting the dots, isn't it?
Right.
Seeing how these ideas translate into those practical actions at the bedside?
Exactly. For example, we talked about Piaget's stages of cognitive development.
Right.
Knowing where a child is in those stages helps us explain things in a way that they can understand,
Right.
using language and examples that resonate with their cognitive abilities.
That's a crucial point. It's not just about, dumbing things down. It's about meeting patients where they are mentally.
Right.
Imagine trying to explain a complex medical procedure to a toddler using the same terminology you would use with an adult.
Right.
It just wouldn't work.
It's like trying to teach algebra to somebody who hasn't learned basic arithmetic yet.
Exactly. You need to build that foundation of understanding first.
Yeah, and it's not just about communication.
Right.
Understanding a patient's developmental stage
Yeah,
can also help us anticipate their needs and their behaviors.
absolutely.
Let's say a toddler is hospitalized.
Okay.
They might regress to bedwetting, even though they've been potty trained for months.
Being in a strange environment, away from those familiar routines,
Yeah.
can be really stressful for a young child.
Right, and it's a normal response
Exactly.
to stress
It is.
rather than a sign of a problem.
Exactly.
So it allows us to respond with empathy and support
Yes.
instead of, scolding the child or making them feel ashamed.
Right.
We can reassure them that it's okay and help them cope with the situation.
Absolutely.
This really highlights the importance of seeing the whole person,
Yes.
not just their symptoms or their diagnosis.
That's right.
We need to consider their developmental stage, their emotional state, their social context, everything that makes them unique.
That's what person-centered care is all about.
Right.
Meeting the patient where they are.
Right.
Not where we expect them to be.
Not where we expect them to be. Remember we talked about Erickson's stages earlier?
Yes.
Let's say we're caring for an older adult who's recovering from surgery.
Okay.
They might resist help with basic tasks, insisting they can do things on their own, even when it's clearly difficult for them.
It happens all the time, and it can be so frustrating for both the patient and the nurse.
It can.
But thinking back to Erickson, could this be related to that stage of ego integrity versus despair?
You hit the nail on the head.
It's a possibility.
For older adults facing a decline in physical abilities and independence,
Right.
can trigger those feelings of despair and that sense of loss of self-worth.
Absolutely.
So they might cling to their remaining abilities as a way to maintain their sense of identity and purpose.
Makes sense.
So instead of getting into a power struggle or dismissing their behavior as stubbornness,
Right.
we need to understand where they're coming from.
Absolutely. By recognizing their need to maintain that sense of autonomy, we can approach the situation with more compassion and sensitivity.
Right.
We can validate their feelings, acknowledge their past independence, and involve them in making decisions about their care.
This reminds me of a time I was caring for an elderly patient who had a stroke.
Okay.
She'd always been so active and social, and then suddenly she was dependent on others for even basic things like bathing and dressing.
That must have been a really difficult adjustment.
She was withdrawn, tearful, resistant to therapy.
Yeah.
And I realized she was grieving the loss of her independence,
Mm.
not just the physical limitations.
Right.
So instead of just focusing solely on her physical rehab,
Yeah.
I encouraged her to talk about her life, her hobbies, her passions.
It sounds like you created space for her to express her feelings.
We did.
And connect with you on a human level.
Yeah, we found ways for her to engage in activities that brought her joy, even with those physical limitations.
Yeah.
She started knitting again, and we'd spend time talking about her family and her memories.
Oh.
It made a huge difference in her mood and her motivation to participate in therapy.
That's a beautiful example of how understanding developmental theories can guide us to provide truly holistic care.
Right.
You honored her emotional and social needs, not just her physical ones.
This deep dive has been such an eye-opener. It's not just about memorizing facts. It's about shifting our perspective.
Right.
And seeing our patients through a developmental lens.
Yeah.
It's changing the way I think about nursing.
And that's what lifelong learning is all about.
Yeah.
We're constantly evolving our understanding of human behavior.
Right.
And that knowledge empowers us to provide better, more compassionate care.
As we wrap up, what's one key takeaway you want our listeners to remember from this deep dive?
I want them to remember that each patient is on their own unique developmental journey.
Yeah.
There's no one-size-fits-all approach to care.
Right.
By understanding the theories we've discussed and applying them thoughtfully, we can create a more supportive and empowering environment for our patients.
Beautifully said. So to all our future nurses out there, embrace the complexity of human development.
Yes.
Keep learning, keep asking questions, and keep that developmental lens in your back pocket.
It will serve you well.
It will make you a better nurse, guaranteed.
And remember, that journey of growth and development continues throughout our lives.
It does.
We can learn something new from every patient we encounter.
That's a great reminder. Until next time, keep diving deep.